Hey everyone, welcome back to another video from Intulect Nursing. Today we're going to go over sickle cell anemia. We're going to go over the pathophysiology, complications, risk factors, signs and symptoms, management, and nursing interventions. So let's get right into it. As always, if you're wanting to take notes along with this lecture, you can find the pathophysiology concept map of the sickle cell anemia within the actual pediatric concept maps. Alright, so what is sickle cell anemia? So sickle cell anemia is a genetic blood disorder characterized by the presence of hemoglobin S. So what that does, it basically makes our red blood cells a C shape instead of an oval shape. So normal red blood cells are composed of hemoglobin A, but these patients have hemoglobin S. So that is the abnormality related with sickle cell anemia. And by the way, the name sickle cell is related to its actual shape. So you could say it's sickle-shaped or C-shaped. So this genetic blood disorder is related to an autosomal recessive mutation of the blood. So basically what that means is that both of the parents have to have the sickle cell trait that would be passed on to their child, which statistics show about 25% chance that the child gets sickle cell anemia related to both parents having the S trait. Before we get into the complications, risk factors, and signs and symptoms, it's best to understand what actually is the problem with sickle cell anemia. So let's go over the pathophysiology. Well, it all comes down to the actual shape of that red blood cell. So why is a C-shaped red blood cell such a problem? Well, for one, that red blood cell does not last very long. A normal red blood cell lasts about 120 days in the bloodstream. This one lasts about 20. So what that does, it increases the demand on the bone marrow and the spleen to reproduce more red blood cells. Number two, these C-shaped blood cells are more likely to clot and cause occlusions in the vascular system, which of course causes multi-organ issues if it ends up happening. And the last reason why this causes a lot of issues is that it's sensitive. So anytime there's an increased oxygen demand that cannot be kept up, these red blood cells cause a lot of issues. Like I said, they're sticky, they're weak, so they'll break down or they'll clot in the vascular system, causing multi-organ issues. And these sickle-celled red blood cells are mixed with normal red blood cells as well, and those can actually damage the normal red blood cells, especially when it does cause occlusions in the vascular system. So to break it down, it causes impaired blood flow, tissue damage, organ damage, and many other complications that we'll shortly get into. But first, let's get into risk factors, signs and symptoms, and then we head to the complications. So, risk factors. As we mentioned, this is an autosomal recessive blood disorder. So like I said, both parents have to have that gene that is passed on to their child. So it relates to about 25% chance of that child getting sickle cell anemia. However, the parents themselves do not have to have sickle cell anemia, they just have to have the trait. And this is called the sickle cell trait. Most of the time with modern tests, the parents do know, but there are chances that the parents do not know they have the sickle cell trait, and it will be passed on, especially if the other spouse also has sickle cell trait. It gives you a 25% chance of that child getting sickle cell anemia. So most commonly this happens within African American families, and statistics have shown that about 1 in 12 African Americans have the sickle cell trait. Now let's head into the signs and symptoms of sickle cell anemia. So there are two sides of this, because most of the time sickle cell anemia presents itself at around 6 to 8 months of age. However, with modern technologies, with diagnostics, we can of course confirm sickle cell anemia when the child is actually in the womb. So most of the time we know, but in the case where we don't, usually it presents itself at around 6 to 8 months. And this is because before these 6 months is up, basically their fetal hemoglobin is still actively in the bloodstream and serving everything that the body needs at that time, but around 6 to 8 months is when these new red blood cells get produced, and that includes the sickle cell hemoglobins. So many times around that 6 to 8 months of age, they'll come in, they're very fussy, they might be tachycardic, they might be short of breath, but a telltale sign at that age is there's edema in the hands and feet. And this is true in even the adult phase throughout their life. So when they have something called a sickle cell crisis, when the sickle cell anemia gets worsened, well, you're gonna have swelling in the hands and feet. You're gonna have increased pain. Usually it's bone pain or organ pain, so it can be systemic throughout the entire body. It's not usually localized in sickle cell anemia. And the reason why the pain is systemic is because it becomes a vaso-occlusive issue throughout the entire body. So there is decreased perfusion to the tissues and to the organs, causing increased pain because of that ischemia. Now, as you can expect, since it is anemia, and that is once again because of that rapid production of red blood cells that have to be produced, and usually your bone marrow and your spleen cannot keep up. Well, with anemia, you can of course expect fatigue, but along with that, since the spleen is working so hard, you can expect something called splenomegaly, which is just an enlarged spleen. Now, when the spleen becomes overrun, its other functions start to get affected, such as preventing infection. So another sign and symptom could be an infection. So these kinds of patients may have frequent infections because of the deficient immune responses. So since a lot of hemolysis or the breakdown of red blood cells happens, you're going to expect something maybe such as jaundice, which is the byproduct of broken down red blood cells or bilirubin. So you're going to have yellow skin, yellow sclera of the eyes. That could be another sign and symptom of sickle cell anemia. Now let's get into the complications of sickle cell anemia, and this is mostly related to sickle cell crisis. So sickle cell crisis is basically the exacerbation of sickle cell anemia, and it's usually related to dehydration or a decreased uptake of oxygen in the bloodstream. So once again, we mentioned that these red blood cells are sensitive. These sickle cell red blood cells are very sensitive to a deficient oxygen amount in the bloodstream. So what happens is they clump up, they break down, and they cause vaso-occlusive issues throughout the entire body. And when that happens, you are more likely to have any risk of clots going on, so pulmonary embolisms, DVTs. That clot could break into the cerebral blood flow and cause a stroke. It could cause acute chest syndrome, which can be related to a pulmonary embolism itself. And of course, another complication could be related to infection all around. So these patients are very susceptible to things such as pneumonia. So make sure you take a look at the white blood cell count and see if they have any signs and symptoms of infection. Not only can it cause issues with macrovascular circulation, it can also cause issues with microvascular circulation. So that includes your eyes. So you may see another sign and symptom here, but these patients have decreased vision. But this can also be related to the sickle cell crisis. They may have acute deficiency in their vision or a decrease in their eyesight. Another complication could be gallstones. Now this is not as likely, but it is related to the increased bilirubin, which then could cause an increase of crystals forming in the gallbladder itself because it's our body's attempt to get rid of that excessive bilirubin in our circulation, which comes through the liver and try to be excreted through the gallbladder. However, this could cause crystals and then end up causing gallstones. So when you think about complications and there's a question on the nursing exam and NCLEX, think sickle cell crisis, where it could cause vaso-occlusive issues, so it decreases the circulation to multi-organs. So it can cause issues with your eyes, your liver, your spleen, as we talked about. So your macrovascular types of issues and also your microvascular types of issues, such as the eyes. And then you're also going to think about infection, so they're increased susceptible to infections such as pneumonia. And those major complications, because of those vaso-occlusive issues where the clotting occurs, it could end up doing a pulmonary embolism or a stroke. Now, as for risk factors and getting sickle cell crisis, what are the things that put you at risk to have complications? So these patients, we really want to do a lot of education and teaching them what could end up causing those sickle cell crisis. And the biggest one is dehydration. So dehydration increases the metabolic demands of our body, and that increases the need for oxygen. So literally anything that could increase the need for oxygen in our bodies could cause sickle cell crisis, because once again, those sickle cell red blood cells are so sensitive to the point where anytime they have increased needs or have to function more than what they can, they end up breaking down or they end up clotting the blood flow in our system. So think exercise, dehydration, higher altitude, recent sickness. So anything that increases the need for oxygen in our body could end up causing sickle cell crisis. Now let's get into the diagnostics of sickle cell anemia. So we talked about this is mainly a genetic testing. So usually we identify this in the womb, especially if we know there is a risk for it with the parents. But the test you're going to be most likely questioned on is something called hemoglobin electrophoresis. This is the thing that confirms the hemoglobin S presence in the blood. Now, of course, they're going to run a CBC. Now, of course, you're going to have a decreased amount of red blood cells, maybe acute if it is a sickle cell crisis. But in general, these patients may have a decreased red blood cell count and a decreased hemoglobin count. Now, what is the management of sickle cell anemia and sickle cell crisis? So if a sickle cell crisis happens, let's say the patient comes into the hospital and they have increased pain, have sickle cell crisis going on, it's because maybe they're dehydrated. So one of those big management key factors that we need to focus on is increasing the fluids. Not only will this treat the underlying issue, it actually is the most effective thing for their pain as well. Once again, why are they in pain? It's because it's vaso-occlusive. It's causing pain because of ischemia going around throughout the entire circulation of the body. It could be related to organ pain, bone pain, it's everywhere. However, when you increase the fluids, it improves the circulation and it usually gets rid of that pain because it solves the issue, the tissue ischemia. Pain medication, of course, is usually scheduled as along with this. It's usually not PRN with these patients, actually. They usually have scheduled opioids to help manage the pain in the meantime. But of course, we don't want to keep on these patients for a long period of time. But the fluids, if you're going to get a question about that on the NCLEX and the nursing exams, make sure you write that down. That's actually the thing that's going to improve or decrease their pain. Now, of course, since they are likely going to be short of breath because of that decreased hemoglobin in the bloodstream, you're going to be giving them oxygen supplementation. And if the hemoglobin goes below the point of possibly 8 or 7, depending on the hospital policies, then you may have to do a blood transfusion. And once again, they're at risk for infection, so we're likely going to be giving them antibiotics while they're in the hospital as well. Now, as for diet, we're going to encourage high protein, high calorie, and high folic acid diet. Now, folic acid could be supplemented as well, especially at home. So they might have a folic acid supplement. That is because it helps keep that production of the red blood cells. Now, in this case, iron is not as helpful for sickle cell anemia. Instead, folic acid is better for this type of anemia. Now, if the patient has that swelling in the hands and feet, of course, you're going to elevate to decrease that swelling. Of course, you're going to be doing, once again, consistent scheduled opioids, most likely, of course, per the provider. But a lot of the times they are not PRN in this case because they want to stay ahead of the pain. And of course, prioritizing those IV fluids is going to treat the underlying issue and also help with the pain much more effectively. All right, guys, that ends the video for sickle cell anemia. I hope this video was helpful. If you guys want to see more videos like this, make sure you guys head to our YouTube channel or go on to the LMS website to look through the rest of these courses. You'll find video lectures, study guides, and quizzes to test your knowledge. Once again, thank you for watching this video, and I look forward to seeing you guys in the next one.